Since the dawn of time, humanity has progressed a great deal in terms of our medical practices.
And while we have undoubtedly made life-saving progress in some of our methods, we have overlooked the way in which our microbiome affects our health and how our healthy practices can actually be detrimental to the bacteria in our bodies.
Big brands like Lysol and OxyClean have made names for themselves inside of the home, with moms and dads alike following their children with a spray and a wipe.
And while cleanliness is something that everyone should consider practicing, humans have a tendency to overdo things, whether it be salt on our French fries or 100-inch flat screen TVs.
Sometimes we must ask ourselves, how much is too much?
If we were to ask where the cleanest place in your life is, you would probably answer with some hospital or local healthcare facility.
And for that, we have to thank Joseph Lister, the British surgeon who introduced sterilization practices using carbolic acid in the 1860s, an act that proved to decrease the spread of pathogens.
But while everything in the building is completely wiped down, 5 to 10% of people who check into healthcare facilities leave with some infection that they didn't previously have.
Wait, how is that possible? I see the nurses cleaning everything in the room.
Since we have already established in previous videos that not all bacteria in our bodies are pathogenic, some being helpful even, we have to consider that not all bacteria in the hospital room are bad either.
Jessica Green, an Oregon-based ecologist, looked into the air of a given hospital room and compared it to the air outside.
While the hospital room air contained a number of pathogens straight from the mouths and skin of hospital residents, the outdoor air contained multitudes of harmless bacteria from plants and soil.
So without continuously cleaning equipment and furniture, how do we protect ourselves from potential pathogens?
The solution? Florence Nightingale, lifesaver during the Crimean War, discovered that patients recovered more quickly from infection when a window was open.
Bringing back the idea of diversity, good bacteria is necessary for the exclusion of bad bacteria.
So by opening a window in a hospital building, we can bring in harmless environmental microbiota that take up space and exclude pathogens without having to worry about over-sterilization.
In addition to the removal of bacteria, it is important to know how exactly we acquire said bacteria to begin with.
In recent years, it has been discovered that birth method is typically the first indicator of what our microbiome will look like.
That being said, whether a child is born through C-section or vaginally plays a big role on what their bacterial community will become.
Weirdly enough, it has been found that when born through C-section, babies typically lack a great deal of the normal bacteria associated with birth.
Rather than getting the bacteria from the mother's bodies, C-section babies first come in contact to whatever is in the air or on the doctor's hands.
It has been found that babies born vaginally typically have a much more diverse microbial community.
And with the rise in C-sections, there are more cases of asthma, allergies, eczema, obesity, and other diseases.
In recent years, a theory emerged that states that the lack of exposure to a mother's microbiota is the cause.
To combat this, mothers today are actually looking into vaginal seeding.
This process is essentially swabbing a C-section baby with the mother's microbiota right after birth.
Shira Levi, the microbiome research manager at the Innova Hospital conducting a study on vaginal seeding, believes that this exposure will improve the health of those babies born through C-section.
Many may find this practice extra, but if we're going to overdo it, we really should be talking about doing something more pertinent.
One of the most common methods of over-sterilization in the health world in practice today is overprescription.
The miracle drug, capable of fixing any infection or curing almost any illness, either begged for by patients or carelessly prescribed by doctors. We know them as antibiotics.
Alexander Fleming discovered the antibiotic penicillin in 1928, with its use becoming widespread by the mid-1940s, and ever since, antibiotics have been saving lives.
Though today's medicine has become so dependent on antibiotics that we often take them when they're not even necessary.
When you think back to a time you've taken an antibiotic, you're likely to remember having some sort of upper respiratory infection.
While it's true that antibiotics can cure almost all bacterial infections, it has been found that fewer than 20% of upper respiratory tract infections are caused by bacteria.
So without knowing whether our infections are bacterial, both patients and doctors alike insist the drug will cure us no matter what.
Even for those infections that are caused by bacteria, such as strep throat, we usually will get better in a couple of days without the help of antibiotics.
So if you're prescribed an antibiotic and you get better, you're likely to believe that it was all due to the medicine rather than the infection running its course.
This wouldn't particularly be a problem if it weren't for our bodies developing a resistance to these medications.
Antibiotic resistance occurs when the bacteria in our bodies become able to overcome the drugs we take to kill them off.
With this resistant nature, antibiotics become ineffective, and the bacteria in our bodies multiply into superbacteria.
Once the resistant bacteria multiply, what were once easily treatable illnesses turn into expensive ordeals, and in severe cases can lead to disability or death.
So how do our bodies become resistant to antibiotics?
The effectiveness of an antibiotic medication is directly correlated to the frequency of their prescription.
The average American goes through 3 courses of antibiotics by age 2, 17 doses by age 20, and 30 by the time we're 40.
With this amount of usage, one can make the connection that the overuse warrants antibiotic resistance.
And once we become resistant to antibiotics, they may not work as well when we actually need them.
But why is this happening?
With these pills, we are successfully moving both pathogens and viridians, the good bacteria associated with harmful bacteria that actually protect our health by inhibiting potential pathogens and modulating the immune system.
The problem with these antibiotics is that they're going about curing us all wrong, bombing our microbial community when really we just need a one-on-one combat to remove certain pathogens.
It's important to say, we don't need to tell you to stop taking antibiotics altogether. Instead, maybe be cautious of how often and for what you take them.
And if you're really worried about the state of your microbiome, there are ways to combat the killing off of the good bacteria that protect us.
Next time you're sick and told to take antibiotics, ask your doctor about options for taking probiotics.
The important thing is that we are all aware of what we're living in, giving out, and putting into our bodies.
Up next, what we eat and how our microbiome feels about our dietary choices.
But don't overdo